Hello, my name is Lorenzo Fabbri and I am a PhD student at the University of Texas at Arlington, mentored by Dr. Christos Papadelis. In this video's abstract, I will be presenting our article titled "Spikes on Ripples are better interictal biomarkers of epilepsy than spikes or ripples." Epilepsy is a neurological condition characterized by recurrent seizures. It affects people of all ages and it is estimated that 500,000 children in the US have epilepsy. The first treatment regimen consists of anti-epileptic drugs. With the use of these drugs, 70% of people are able to control their seizures and can conduct normal lives. Unfortunately, the remaining 30% still experiences seizures and is diagnosed with drug-resistant epilepsy. At this point, to achieve seizure freedom, epilepsy surgery becomes the only solution. The goal of surgery is to target the epileptogenic zone, which is the area that is indispensable for the generation of seizures. Unfortunately, the epileptogenic zone is only a theoretical concept and cannot be measured directly, but it can only be estimated through other biomarkers such as lesions on the MRI, spikes produced by the irritative zone, high-frequency oscillations generated by the HFO zone, and the seizure onset zone, which is the brain area where seizures are initiated. Spikes are the most established biomarkers of epilepsy, yet they suffer from low specificity since they are only partially concordant with the epileptogenic zone. High-frequency oscillations, defined as at least 4 oscillations above baseline, are divided into ripples and fast ripples according to their frequency, and are considered more specific biomarkers of the epileptogenic zone compared to spikes. Fast ripples are often associated with the epileptogenic zone but are less frequently observed. Ripples are present in most patients with drug-resistant epilepsy, yet not all ripples are pathological, as they can also occur in physiological brain areas. Therefore, the question is, how can we differentiate between physiological and pathological ripples? In our article, we examine the temporal relationship between spikes, ripples, and fast ripples, assess their ability to delineate the epileptogenic zone, and to predict surgical outcome in children with drug-resistant epilepsy. We hypothesize that spikes overlapping on ripples are better biomarkers than spikes or ripples alone. To do this, we detected spikes and HFOs in an automated fashion and visually validated the results, compare rates of biomarkers between regions resected and spared during surgery, as well as regions deemed to be part of the seizure onset zone. We also correlated the resection of a biomarker to the patient's surgical outcome. In total, we analyzed 40 patients with drug-resistant epilepsy who underwent epilepsy surgery after extensive intracranial EEG. 26 and 14 patients had good and poor outcomes respectively. The median age was 12.5 years old. 22 patients were males. We analyzed approximately 115,000 spikes, 101,000 ripples, and 50,000 fast ripples. About 85% of spikes, 80% of ripples, and 30% of fast ripples occurred alone. Ripples and spikes were seen for all patients, as well as spikes plus ripples. Fast ripples were seen in only 17 patients. There were no differences in the rate of biomarkers between good and poor outcomes. We observed higher rates of all fast ripples, spikes plus ripples, and spikes plus ripples plus fast ripples inside compared to outside the epileptogenic zone. This pattern was observed only for these biomarkers and only for good outcome patients. In predicting the epileptogenic or seizure onset zone, all biomarkers showed a similar ability, but we observed a positive correlation between the median spike rate and spikes plus ripples performance to localize both the epileptogenic and the seizure onset zone. But this was not observed for all spikes. The resection of all fast ripples, spike plus ripples, and spikes plus ripples plus fast ripples predicted good outcome. No other biomarker was able to do so, including the clinically defined seizure onset zone. Moreover, spike plus ripples was a better predictor in patients with frequent spikes. Altogether, these findings indicate that fast ripples are the best biomarkers, but they can only be seen in a few patients. Spikes plus ripples are a good alternative because they can be seen in all patients. Their resection predicts good surgical outcome and their performance is improved in patients that frequently show spikes. I would like to end this video by thanking my mentor, Dr. Christos Papadelis, and our research group at Cook Children's Medical Center for their support. Thank you for watching.